Doctors across the country have been reporting there are more and more younger adults very sick in their hospital wards. Many of those patients seem to be breathing just fine until doctors check their blood oxygen levels. And so John Northcott is here with what those experts are telling us. John, it's essentially a warning for Canadians. You may be sicker than you think, and what the indications may be.
Yeah, this is not just for young people, although if they are very young, there can be elements of communication. Let's face it, communicating with teenagers and understanding what's going on in their lives can be complicated at the best of times for parents. But what we're going to talk about are signs that any individual could recognize in themselves. Some particular urgency after a couple of weeks ago, Ontario's chief coroner came out and said that a number of people had actually died in their homes. Now, there may be issues around isolation there, but there are also issues around the way the virus, and in particular, the way the new variants work in the speed in which they work. And anyone who has seen a relative dealing with COVID-19 will know that there is that heavy labored breathing, particularly a breath. And here's something I can tell you about in terms of being able to and have to breathe for every word. There is that desperation and that need for oxygen that is really a sure sign that you are in a very bad way. Heart palpitations as well. Checking oxygen levels. And again, this is something a parent can do. An oximeter, not expensive, not painful. You just stick it on the end of your finger, and a regular oxygen intake should be between 95 and 100%. When it starts to get below that, be concerned about that. The other aspects too is that it can turn very quickly from a labored breathing, from a heart palpitations, to the point where the difference between life and death can be a matter of hours. So all of that to be watched for. Also in particularly young people, for example, dehydration. Is the young person not going to the bathroom with any degree of regularity? Are they not drinking fluids? Are they refusing to drink fluids? Are they not themselves? Look into their eyes. Can you see that spark that they normally have? Or is there some issue there? Are they falling asleep at odd times? All of this, they are asking doctors that CBC News has talked to observe. And if you see them, don't hesitate to seek medical attention. Heather?
This is such a great list and practical for parents to consider, John. Even if they look at those kinds of things, they may think, I don't want to use up hospital resources. Emergency departments might be crowded. I don't want to expose myself or my other family members to COVID in the hospital. What do doctors tell us about those considerations?
Yeah, let's face it, it's natural. The news is filled every day with stories of ICUs overflowing. People may even be concerned if they don't know for sure that the child or even themselves have COVID-19, of exposing themselves in an emergency room. But doctors we've talked to for months now are very clear. If you feel you have COVID, don't be frightened of seeking that medical attention. Here's Dr. Zane Chagla.
Crushing chest pain, shortness of breath, immediately going to the emergency room and being assessed for that. If you say you have COVID and you have chest pain, I think every emergency doc has that as the first thing on their mind. It might be something minor, it might be something you get sent home with, but again, you would rather put that in the hands of someone that's seen a lot of COVID-19 as compared to, you as the individual dealing with COVID-19.
There's the key takeaway there. They are medical professionals, and not only that, they've been dealing with the reality of COVID for months now. They know, you don't. If you're worried, if you're concerned, go seek their help.
Thank you, John.
Okay.